And welcome back. A recent report from the Center for Urban Futures has brought attention to the rising financial insecurity among older adults in New York State. The report reveals a concerning surge in poverty rates and a lack of retirement income for many seniors, with certain regions seeing staggering numbers of older adults with no retirement savings or Social Security income. Joining us to discuss the alarming findings of this report is the data researcher at Center for an Urban Future, Rachel Neches. Welcome, welcome, welcome.
Hi, Bob. Thanks for
Rachel,
having me.
Rachel, those are definitely staggering numbers and staggering information. How did it happen? How can we correct that?
Yeah, absolutely. Well, thank you so much for having us on this show to highlight a very real issue that is happening right now. Our report at the Center for an Urban Future reveals an emerging financial insecurity crisis facing older New Yorkers across
Yeah,
the state and in the Bronx in particular. Poverty rates are on the rise, older adults are working longer, and less are reporting any retirement income.
yeah. What are some of these
That's,
key findings of this report and why are they so alarming?
yeah, absolutely. I think it's alarming for everyone. I mean, to see our parents and our grandparents struggling with these challenges is going to be alarming for really everyone. At the end of the day, far too many older New Yorkers are financially insecure and are struggling to meet ends meet. When it comes to why this is happening, at the end of the day, we don't know, but we do know a couple of factors here, right? Many older New Yorkers have been working for 20 to 30 years in low
Mm,
wage jobs, living paycheck to paycheck, and haven't had the opportunity to put savings or retirement away. And
yeah.
that itself is going to prove to be a real challenge when it comes to preparing for your financial future.
Yeah, and the report highlights a significant percentage of older adults, especially in the Bronx and Brooklyn, have no retirement income. What are the implications of this for their quality of life?
Yeah, absolutely. Well, I think a huge data point here that is particular to the Bronx and really concerning is that over 60% of older adults in the Bronx last year did not report any retirement income. There are a couple factors. The Bronx has a high percentage of older adult immigrants, right? So if you came here as an
Ah,
adult and you didn't pay into or have time to pay into the Social Security system, you may not be receiving the same amount of benefits that a US born older adult might be
yeah,
receiving.
yeah.
Yeah.
There are a lot of older adults choosing to work past retirement age, and what challenges do they face doing that?
Yeah, well, we do know that there are some older adults who want to be working, right? Like if you love your job and you're living for
Mm,
longer and you are healthy, you might want to be engaged. But we also suspect that there is a number of older adults who are working longer to make ends meet. And there are a number of implications when that comes to that. It's a real, um, challenge, and especially as costs rise
hmm.
and incomes remain fixed for many older adults, it's hard to stay afloat.
Rachel, what regions are most affected? Are there some more than others?
Absolutely. I mean, the Bronx is facing like a strong challenge when it comes to financial security compared to the rest of the state. I would say that
Yeah.
we saw really high levels of retirement, a lack of retirement income, as well as Social Security and poverty rates were the highest in the Bronx. But also, there are some demographics within the Bronx that face particular challenges, and a
Yeah.
lot of them are New Yorkers of color. So Asian, Hispanic, and Black older adults faced higher poverty rates than white older adults in the
Uh,
Bronx, as well as immigrant older adults.
and then the cost of living, of course, is higher than normal, so that affects them also.
Absolutely. I mean, we're seeing that everywhere. Food, healthcare, housing, all of these costs are getting higher. But a lot of times, if you're living on a fixed income, the amount of money that you're getting is not rising at the same pace.
And so you have to make a decision whether to keep a roof over your head or buy food or buy gas for your car if you have a car. Um, it just came out, what, last month that the egg prices, They were selling Lucy's in the Bronx, 3 eggs for like $2.99. Almost
Yeah.
a dollar an egg.
Wow. Absolutely. I mean, it's a financial crisis that I think everyone is feeling right
Yeah.
now. And it's that much more important for us to be advocating for those who may not have as strong as a voice at this moment.
What role does Social Security play in supporting older adults, and why is it not enough for so many seniors? Well, you mentioned a little bit about it. Some of them are immigrants, just came to the country, and they
Yeah,
just became
absolutely.
citizens.
I mean, Social Security has long been like the most important safety net
Mm.
for older adults across the country and in New York City. I don't know if Social Security, in terms of the amount, is keeping up with the rate of inflation that we're seeing and the cost of goods and housing and all of that right now. And in addition to that,
Mm.
New York City has such a huge immigrant population. Again, if you came here as an adult and you didn't have the time to pay in to the Social Security system, you may not be receiving the total amount of benefits that someone else might be, which is
Yeah.
leaving a lot of people with big needs.
Rachel, in your research, do you also find out what other organizations or nonprofit organizations or CBO community-based organizations can help out in helping to support them?
That's a great question. I mean, there is an incredible network of organizations that are working on the ground every single day in New York City.
Yeah.
And one of our recommendations, and our report offers a set of 10 actionable recommendations for policymakers to take action on. One of them is to invest in eliminating waiting lists for key aging services that are often provided by these amazing nonprofits and CBOs because the need and the demand is there.
Yeah. And they also need a list of a lot of the things that they have discounts on, whether they go to a restaurant, they give them a discount, or hotels, or whatever they need. Do you get a discount on housing as a senior? They need a list of all those things that they can benefit from.
Absolutely. There's a real challenge too, where a lot of older adults are eligible for so many benefits, but well, benefits, but do not know that they are eligible and
Yeah.
thereby are not enrolled at the same rate. So, what we need to do and what policymakers need to do is to push to make sure that all eligible New Yorkers for these benefits can gain access to them.
Yeah. What are some of the other potential solutions for reducing healthcare costs for older adults, particularly regarding prescription drugs? I know there was a lot of talk about that in the last administration.
Yeah, policymakers really need to work to lower healthcare costs for older New Yorkers, and I would say for for all New Yorkers.
Uh,
But one of the ways that they can do that is by allowing the state to import low cost prescription drugs from Canada. That's sort of an actionable recommendation that we've put in the report to find ways to
yeah.
mitigate rising costs.
Yeah. What about the earned income tax credit? Can you elaborate on the proposal for a state vision or version of the earned income tax credit for adults over 65?
Absolutely. Well, in our report, there are a number of
Uh,
sort of tax credits and suggestions that we have for policymakers to expand sort of those benefits that older adults can receive and find ways to increase that safety net so that we don't have more older adults slip through the cracks.
yeah. And if you were talking to an auditorium full of seniors, what are some of the words you would like to uh, talk to them about that they can use right there? Some tips, maybe.
Yeah, absolutely. I mean, this whole report is sort of a wake up call for policymakers whose decisions affect older New Yorkers and
Yeah.
all New Yorkers every single day.
Hmm.
I would say that, we see, and this research shows that so many older adult New Yorkers are struggling financially more than ever before and are struggling to make ends meet. And this report hopefully shows that like we
Yeah.
see you and we want to be there for you.
Yeah. What about the elected officials? Anybody reaching out to the elected officials? Talking about New York's aging population and how it's growing rapidly, and the steps that should be taken, leaders can take to prevent this crisis from worsening in the future.
I think there are a number of steps that policymakers need to be taking. I think this needs to be a primary objective on the
Hmm.
next agenda. It's easy to let issues of aging fall behind. However, we cannot have this. We cannot afford to have thousands more older adults fall below the poverty line,
Yeah.
especially as the older adult population is the fastest growing demographic in New York. So this is an issue that's only going to get worse if we don't address it.
Yeah. All right, everybody, let's get together. Let's chip in and help our seniors because one day you're going to be a senior also. So, community-based organizations, let's go. Maybe people would like to start a nonprofit. Maybe this will be an area that will be of interest to you, helping others get what they need out of life and helping seniors wade through all of this hectic stuff because they become a little older and sometimes they can't even read a lot of the stuff that's coming through. You go to the hospital, who's going to explain what all of those things mean when you have to sit in the hospital and get information from your doctors?
Yeah, we really need more support services in every single regard. And I think, as a community, like just pulling together and making sure that we're there for our neighbors.
Well, from your point of view, how can we contribute to improving financial security for older adults?
There are a number of steps that need to be taken. One that I haven't mentioned yet is the need to increase affordable housing opportunities for not just older adults, but also their caregivers.
Yeah,
That can be done in a couple of ways. Like one is by incentivizing new housing development. Absolutely. Another is to encourage the development of and facilitate the development of accessible dwelling units, promoting the plus one ADU program that helps low and middle income homeowners build ADUs on their properties.
yeah, yeah. And how can they find out more about, especially the caregivers? I guess they're going to be reading all the information mostly and then trying to explain it to the seniors. Um, how can they find out more? Is there a website? Can they see more of what you're talking about?
Yeah, absolutely. If you sort of just look up the Plus One ADU program, there's research and resources out there for you. But generally speaking, I think there's an affordable housing issue out there, and we need to make sure that not just, as you're saying, older adults are aware, but also caregivers who are an important messenger of communication and information
Yeah.
for our older adults.
And caregivers are going to need the help too, because sometimes they work very, very hard. I mean, I know my sister used to take care of my mom, and I know um, the work that she put in taking care of mom, and she needed help also. So there has to be something for that whole community, everybody
Definitely. I mean,
involved.
we need to make it easier for family members to take care of their older family members. I mean, they're the most wonderful caretakers at the end of the day as well, right? So how
Yeah,
do we make that as a state easier and more feasible
yeah.
financially?
Rachel, is there anything that we missed that you would like to let our viewers know about?
I would just say that I would encourage anyone who's interested to go read a report about the emerging financial insecurity crisis among older adult New Yorkers. This report reveals a lot of data and is truly a wake up call for policymakers whose decisions directly affect older New Yorkers every single day. This is a real issue. Um, and more older New Yorkers are financially struggling than ever before. So let's
Yeah.
take some action.
Does your organization have an outreach program where it goes out to the schools, goes out to the senior centers or
So our
community centers?
organization, we're an independent research organization. So we have totally like non-biased research that we get to do. It's been amazing getting to
Hmm.
hear from and learn from the people who work on the ground every single day at these older adult community centers and so much more. And there's so many people who are doing that work on the ground. And we're very lucky as a community to have that.
Yeah. And the organization has been doing this for some time now. How many years have you been in business?
Over 20.
Over
very
20
long.
years, yeah.
Yes.
Center for an Urban Future. Yeah, we like it. Thank you for all the work that you do and continue to do. We appreciate you. Thank you for that.
Thank you so
All
much.
right, there you go. Rachel Neches. All right, we'll take a break. I've got more coming your way next.